Have you noticed mucus builds up in your chest day after 65, and you're told it's just getting old? What if I told you it's your body's alarm bell, and there's a simple, natural way to silence it for good? Picture this. I walk into my clinic, and Mrs. Banerjee, 68, is there with her handkerchief again, clearing her throat, eyes tired. She's been coughing up mucus for months. She's on antacids, expectorants, inhalers, yet nothing sticks. I see this every day, patients convinced it's just part of aging. But here's what I've learned over 20 years as a doctor. Constant mucus isn't normal. It's a message. And when we actually listen, when we guide the lungs back to balance, amazing things happen. Let me take you on a journey through why mucus becomes chronic after 65, what your body's really trying to tell you, and 5 gentle, natural steps that help stop the cough for good. I'll also share real stories. You'll meet people like Mrs. Banerjee and Mr. Rao, who reclaimed clear airways and freedom. So stay with me to the end, because what awaits you is clarity on breathing and real-life change. You ready? Let's breathe in and dive in. It begins with a snapshot of the lungs. Tiny airways lined with cilia, microscopic hairs that sweep mucus and dust out. These cilia work well into our 50s, but as we cross into our 60s and beyond, their efficiency drops. They slow, they clump. Mucus pools. Add age-related collagen changes in airway walls, decreased immune responsiveness, and you get a recipe for daily mucus. It's common, but not normal. Then there are triggers. Mild acid reflux that tickles your throat, undiagnosed postnasal drip from seasonal allergies, or low-level air pollution that stirs inflammation. Each day, a little more mucus, a little more throat clearing, and suddenly older adults see these symptoms as just life now, never knowing how to truly ease them. Enter natural solutions based on physiology, simple science, and remarkable stories. One patient, Mr. Rao, 72, was on his 6th cough remedy when I met him. He felt hopeless. We started gently. I asked him to try a warm salt water gargle every night before bed. Salt draws fluid out of swelling tissues. It soothed his throat within days. With consistency, the nightly mucus dropped. Next, we tackled hydration. Not just water, but herbal teas. Ginger lemon tea with honey and turmeric. Ginger calms inflamed airways. Turmeric is a natural anti-inflammatory. He drank 2 cups daily. 2 weeks in, he was coughing less. He felt better. Then I introduced nasal rinsing. Simple saline neti pot every morning. It clears postnasal mucus upstream before it drips. Combine that with avoiding spicy fried foods, known reflux triggers, and he started sleeping without waking to clear his throat. His whole day changed, but we weren't done. I taught him breathing enhancement exercises, gentle diaphragmatic breathing, 3 times a day for 5 minutes. He'd place a hand on his belly, inhale slowly, exhale gently, training his lungs to clear deeper mucus and engage the parasympathetic system, which calms everything. This unlocked better chest clearance and relaxed his airway muscles. Finally, we introduced dietary support, an anti-inflammatory diet rich in leafy greens, omega-3 fatty acids from flax seeds, and colorful fruits rich in quercetin, known to support respiratory health. Over 30 days, he went from daily mucus and throat clearing to once a week, and that one, he recognized it was because he forgot his nightly gargle or skipped tea. Now here's the turning point. He stopped fearing his lungs. He started enjoying morning walks again, breathing clear. One day, he walked into my clinic and said, "Doctor, I didn't clear my throat once this week." That moment, that freedom, is why I share this with you. Let me pause. You might be asking, "Doctor, will this work for everyone?" Fair question. If mucus is from COPD or a serious lung disease, these natural steps complement, not replace, your treatment plan. Always check with your provider. But for low-grade daily mucus after 65, these steps often bring remarkable relief. So let's walk together through these 5 powerful steps. Explain clearly. Salt water gargle every night. 1 teaspoon salt in a glass of warm water. Gargle 30 seconds. Spit. This soothes throat and reduces mucus-producing inflammation. You can easily do this before bed. Many patients like the fresh feeling it leaves in their throat. Hydration with purpose. Aim for at least 2 liters of fluids daily, including herbal teas that help reduce inflammation. Ginger lemon turmeric tea is my go-to. Slice ginger, squeeze lemon, add a pinch of turmeric, stir in honey. Drink warm or at room temperature, twice a day. Nasal saline rinse each morning. Use a neti pot or saline spray to clear nasal passages. This prevents post-nasal drip from accumulating overnight. Simple saline solution, half teaspoon salt and a pinch of baking soda in 8 ounces of warm water. Breathing exercises. Stretch your lungs and engage your diaphragm. Comfortable sitting or lying. Place one hand on your chest, one on your belly. Inhale slowly for 4 counts. Feel your belly rise. Exhale for 6 counts, belly falls. Repeat 5 minutes, morning and night. Anti-inflammatory diet. Include leafy greens, berries, fatty fish or flax, and colorful vegetables. Avoid spicy fried foods and late-night meals that may trigger reflux. These foods reduce body-wide inflammation, including in your airways. Weave these steps into your day, and here's what happens. Mucus production decreases. Airway inflammation calms. Cilia start working more effectively. You breathe easier. Coughs become infrequent, or stop completely. Energy returns. Sleep improves. I know it sounds simple, perhaps almost too simple, but often the body just needs consistent, gentle guidance. Not prescriptions, not inhalers. Just respect, rhythm, and roots. Let me tell you about another patient, Mrs. Das, 75. She began these steps, and after 2 months, she said, "Doctor, I'm not clearing my throat every 5 minutes anymore." That's the relief we're aiming for. And here's a secret. When you treat mucus naturally, you're not just clearing your throat, you're clearing your mind. You're calming your body. You're telling your lungs, "We've got your back." As you watch this, think, where could you start? Maybe tonight, with a saltwater gargle. Then tomorrow morning, a warm ginger tea. Imagine 6 weeks later, waking up without that tickle you've gotten so used to. Before we finish, this is important. If your cough brings up green or blood-tinged mucus, or you have fever, chest pain, or breathlessness, even after trying these for more than 2 weeks, please see a doctor. These natural methods ease mild chronic mucus, but they aren't substitutes for urgent medical care. Now picture the future. 1 week in, your throat is quieter. 2 weeks, mucus is thinner. 4 weeks, sleep is deeper. 6 weeks, your throat only clears a few times a week, if at all. Breathing feels clear, lungs feel supported, and emotionally, you realize you're still vibrant, capable, and free. Thank you for staying with me. This isn't just a remedy video. It's a reminder. Our lungs are brilliant. When we listen and support them, they heal. If this journey resonated with you, hit like, share it with a friend who coughs every morning, and subscribe, because I'll share more simple doctor-grade, natural tips that transform how you age. Tell me in the comments which step you're trying tonight. I read every one. Here's to clear lungs, peaceful nights, and vibrant years ahead. Breathe well, be well.